Hey guys, I'm here to talk to you today about peripheral neuropathy and peripheral neuropathic gait. So with peripheral neuropathy, it's caused by damage to or a disease affecting the nerves, which may impair sensation, it may impair motor or gland or organ function. So with us, with peripheral neuropathic gait, it's mostly sensory issues affecting the lower extremities. So some of those causes would be diabetes, shingles, HIV, Lyme disease, and Guillain-Barré. So we're going to cut to a quick video of us showing this gait pattern here.
With a neuropathic gait, sensory nerves are impaired. The patient has a wider base of support, and they also have shorter step length and slap their feet so that they can feel the ground. They do all of this to maximize the foot clearance from the ground and to also maximize their stance phase. Here's that gait in slow motion.
So as we saw a video of steppage gait. So some of the concerns that we would have with steppage gait or neuropathic gait would be safety, so around the home environment, just like things in the way, that sort of thing. With balance, so they're going to be a little off balance since they don't have that sensory information coming in, getting that nice sensory feedback. Then also like crowded public spaces, if they can't take their time and they can't really focus, they're more likely to trip. And also, the next point would be skin integrity. We would want to watch out for pressure ulcers and also infection. So with that in mind, we would move on to our treatment plan. So what we would have to do is educate our patients. I would say we would probably want to try some nerve glides. We'll get into more of that later. Choosing the proper assisted device to best suit this patient, and also balance and gait training to also help best suit our patient with their function. So a few talking points for education. The use of assistive devices, we would want to teach them, demonstrate that to them, which we will talk about later. We would want to check skin integrity. That's a huge talking point for patients, especially with the pressure ulcers and to avoid infection. Then also repositioning, home safety. So we would want to make sure, like I said earlier, make sure nothing's in the way, like cats, books, obstacles, anything really. And also just to consult their doctor, their pharmacist, and so forth, just to make sure they don't have any medication changes which could further prohibit them from progressing in treatment. And so next we're going to cover some nerve glides and explain what those would do.
One exercise we can use is called a nerve glide. In order for a nerve to function at its full potential, the nerve needs movement, blood, and space. The nerve glide Stephen is demonstrating here is called a sciatic nerve glide. This will help keep that nerve at its full function.
So part of the treatment plan is picking the proper assisted device for this patient. We chose the rolling walker for a few different things. One, the rolling walker provides stability with the wide base of support. Two, it helps facilitate a 2-point gait so that the patient can continue walking with a positive step length while using the walker. 3, the patient will have weakness in bilateral lower extremities due to the neuropathy. And like I said above here, the walker will give the patient a wider base of support to give them more stability when they're walking.
Alright guys, so you already saw a video of us showing you steppage gait and why steppage gait occurs. We also showed you steppage gait with an assisted device and how that would help, and also some of the proper fitting for it. Then we also showed you nerve glides and how that would benefit or help maintain that nerve function in the lower extremities. And we also showed you some education talking points which would help educate our patients on home environment and so forth. So the main takeaway points, if you didn't listen to any of our other part of the video, it would be safety first. So make sure to keep our patients safe, stable, and upright. We don't want any falls. And the second point we would want to take away with, since they don't have that sensory input, would be skin integrity. We want to make sure to avoid pressure ulcers. That way we can avoid infection and we can cut back on hospital stays. So that's it, everybody. Subscribe below, like our video, and we will see you in class.